Give me a couple of minutes to figure out which questions you get wrong. Okay. Okay, so just go one by one. Number 2. This one is migraine headache, tongue is red with yellow coating. So excess heat, right? Pulse is wide and rapid. So this is more like a liver fire, right? So, and number 8, it's 5 element. Yeah, this 5 element, depression, mood swing, hypochondriac distension. What is this? Yeah, it's excess or deficiency? Yeah, excess. So in excess, how do you do it? Sedate or tonify? Yeah, sedate. The sun, right? What is the sun of the wood? What is the sun of the wood? Fire, right? So sedate fire. Okay. Okay. And you still have a question, Evelyn? Yeah. Hmm? Excess, you got it confused. Excess, you have to sedate. Deficiency, tonify. So deficiency tonify means that the condition is deficiency, you tonify mother. This is liver chi stagnation, this excess condition. You sedate the sun, right? So it's simple, like excess condition, sedate. Deficiency condition, tonify, right? Sedate the sun, tonify mother. Just remember that. Mm. And regardless, this is not nothing to the four needle technique. It's this. So this is basically five element. So you probably have wrong idea on the four needle technique because this is the same. Like basically they tonify and set it. And four needle technique sometimes they use overacting, but yeah, that's like a that's really not really common. So just focus on the sedate the sun and tonify mother. Yeah. That is the key. Number 13. So this patient has a fever and aversion to cold. So this is exterior. And feeling of heaviness, this is dampness, right? Tongue is red, red on the side. So this is a heat. So damp heat and rapid pulse, right? So this is damp heat at the exterior. So this is like a, this is, so that is what summer heat, right? Because usually summer heat suddenly and high fever, profuse sweating, and severe headache is very common, and feeling of nausea and vomit, right? So, and choice B. And 20. So that is a wembing, right? Summer heat thing. Oh, fishy smelling. Yeah, this is heat in the lung. Sometimes they on the exam like this. So fishy smelling, yeah, remember this. This is heat in the lung. 21. What is the facial complexion of spleen Chi deficiency with the water retention patient? So this is a spleen Chi deficiency, uh, earth overacting on the water. So this is so spleen Chi deficiency with water retention. This is a darkish complexion. Yeah, because this is an overacting. Actually, it's the deficiency cause water retention. I think this question is not really good because when we study the facial complexion, overacting element manifests on the facial complexion. And in this case, to be a darkish complexion has to be water has to be overacting on earth. But actually earth overacts on the water, kidney, not the kidney overacting on the spleen. So this is wrong and wrong question. So I'll correct them all. So 21. This question is not correct. 24. Oops. Which meridian pass through the tibialis anterior, extends the digitorum longus and extends hallucis longus? So this is like a, yeah, this what the gallbladder and the stomach channel, right? So A. Yeah, sometimes they ask this, give some like a muscle and tendon, and yeah, they want to figure out the channel. And 20, 37, next day 37. A patient complained of difficulty falling asleep. So difficulty of falling asleep, disturbed sleep, palpitation, poor memory. So when the lassitude, listlessness, anorexia, and has a cellular complexion. So this is, yeah, like a spleen Chi deficiency with heart blood deficiency, okay, because palpitation, poor memory. And so falling asleep means blood deficiency. I don't know if it's liver or heart so far, but the palpitation, poor memory is more heart blood deficiency. And the cause of this is with this very clear spleen G deficiency, right? So this is deficiency of spleen and heart. See, yeah, this is more Guipitan case. 47, if the vein of the infant past the wind gate, the pathologic factor is way level, right? Because the wind gate means it's way level. Chi gate is like a heat or interior, and life gate means the children is in danger of life. So probably just confused, right? Just past the wind gate means it is an exterior condition. This. No. Because if the venue is not past the wind gate, it's nothing. So, but past the wind gate means this is exterior condition. The chi gate means that now the pathogenic factors enter into the interior. So past the wind gate means it is still in the exterior. But if there's a chi gate means the pathogenic factor is interior. Okay. And the 56, if a patient has a constipation and the stool has hard beginning, loose afterward, so this is typically a liver and spleen disharmony, right? So liver stagnation attack the spleen, make loose stool, and during the liver stagnation, like the digestive tract constipation. So remember, liver and spleen disharmony has the pattern of constipation and diarrhea alternating. Okay. 63. A female patient diagnosed as benign uterine fibroid. So usually benign means it's not really blood stasis. It's palpable fixed in location in the rubbery. So this is phlegmy. C. 65. A patient is suffering from headache with feeling of empty-headedness and radiating pain towards the tooth. This is kidney insufficiency. Empty-headedness, yes, kidney insufficiency. And 70. A patient complain about uncomfortable sensation, hypochondrium, abdominal fullness, loose stool, no desire to eat despite hunger. Yeah, this is knowing hunger. This is Saoyang syndrome, because I didn't mention about the alternate interest and fever, but this hypochondriac pain and the abdominal fullness, loose stool, sometimes vomit, bitter taste, wild pulse. Yeah, this is all Saoyang syndrome. So, when you study the sixth stage of Shangan, I told you in the class that this Saoyang pattern is on the exam lately without having alternating chills and fever. So you have to look at it carefully. Okay. 72. 3 days ago, 23-year-old male patient came down with fever. So you got a exterior wind, right? After taking aspirin, original cold disappeared, but the fever remained. So now, probably that pathogenic factor is going interior. Yesterday, his symptoms included lethargic, severe headache, and dry mouth, but no desire to drink. So it's thirsty, but no desire to drink. And nausea and desire to vomit. Red tongue coating with yellow greasy coating. So this is damp heat, right? Rapid and slippery pulse. So this is damp heat. 78. The pain and the contraction of a scrotum This is like a liver, right? Shan disorder. So this is cold in the liver channel. 81. What characterizes the breathing of asthma caused by kidney yang deficiency? This is difficult inhalation because the kidney grasps the chi, inhalation, right? Lung exhalation. So yeah, this is a difficult inhalation. 81. 82. Fever with aversion to cold, sore throat, thirst, headache, superficial rapid pulse, white tongue coating, loose stool, chilliness, and profuse pale urination. So this first line is more exterior wind heat, and this is internal cold. So this is cold in the interior, heat in the exterior, right? A. 86. Oh, 68 old female suffering from dull pain in the chest area for 2 months. So this patient has a dull pain in the chest for 2 months. Then like the last I don't know. I mean, it depends on which format you want to. I mean, which exam type you want to choose on the exam. But some exam is a very long cases, a lot of long cases, and this is not really good for the like international student who's not English is not their main language. So when you see this kind of long case, uh, that you probably really stressful, right? So usually, and while you read this up until like this tongue and pulse, you already forgot the beginning. So you go back and read again, spend a lot of time. So in this case, uh, just read like yeah, chest pain, in the dull pain in the chest, uh, and then see the tongue and pulse. Yeah, go to tongue and pulse. His dull face, no, his tongue is dark purple color and scanty coating, and the deep pulse. So this is uh, the purple color means this patient has blood stasis, right? And yeah, deep pulse means probably it's more likely uh, like inside or cold, but don't see any cold sign here, right? Because scanty coating like that. So, but usually in my question, I don't give you a so delete that is not blood. Liver, no, this is not liver. So C is not going to be answered. So A and B and C, liver fire is not liver fire, so eliminate liver fire. So heart and kidney insufficiency and blood stasis or spleen chi deficiency and heart blood stasis due to blood deficiency. Uh, yeah, so it is many times it is easier to go to the answer. You know what I'm saying? Like see the first line, the chief complaint, and the tongue and pulse, and then go to the answer. So tick. I mean, not. Oh, sorry, there's blood stasis too. But usually on the exam, there's two has a blood stasis, two doesn't have a blood stasis. So you can choose usually like between these two, and then you see like yeah, during this period his work was increasing heavy, pain becoming more frequent and tired. So pain is more frequent when tired means most deficiency, right? Weakness and palpitation. So this is heart. So coronary artery disease by MD. So there's like here like a deficiency cause more worse. That means deficiency is the cause of blood stasis, right? Because heart and kidney insufficiency is not leading to the blood stasis. So the answer is out of this, B is the best answer. So you use that like uh, those exam technique that read the first the chief complaint, tongue and pulse, go to the answer, tick out the the wrong answer. Usually there's two wrong answers, and then you consider between these two, and then go back and complete all the things. Because if you read this and then you lost, so Usually when you attack this lengthy case, the technique is that read the chief complaint, tongue and purse, go to the answer and go back like this. Okay. 88. A red and swollen tongue filled up the whole mouth indicates, this is a heart and spleen fire. So this is all Giovanni's diagnose, observation like that, smelling. So they usually have one patients of like the smelling and the observation like that. So this is one of those. Right? And 92. When fear causes chi to descend in children, this is most likely, because the fear descend, fear makes the chi descend, and in children cases, nocturnal the urination, right? Nighttime urination. So 92, 94. If a patient is suffering from heavy bleeding, so this heavy bleeding is caused by chi deficiency, or heat, or blood right? So it's heavy bleeding is chi deficiency or heat. So in this case, the chi, tonified chi, promotes sweating. So tonified chi cause heavy bleeding. Tonified yin, tonified yang is fine. But promoted sweating is, if it's heavy bleeding, do not sweating. Okay, it's contraindication. If like a patient has a lot of bleeding, do not try to sweating. If patient has too much sweating, do not try to bleeding. So that's that, using that analogy. Okay. And 99, which of the following can be the cause of yin and wei disharmony? So yin wei disharmony is like a qi deficiency. Qi is like a, so qi is divided by yin qi and wei qi. So yin wei disharmony cause some kind of if it is internally, like a wei qi is in problem, then like you can catch a cold, like the Guiztan case. If inwardly someone internally, this is like a Xiaojianzhongtang case, right? So this is, in this case, more likely irregular diet, because that's caused a qi problem. So B. So any other questions? $51. Ache all over the body, feeling of tiredness. So this is a ache all over the body, means it could be deficiency, Qi and blood deficiency, or dampness, or B syndrome. But second line, feeling of tiredness is that like making this deficiency condition. So answer is C. Like let's say, like if it's Qi stagnation, usually more tightness, and feeling of distension. Damp B, probably more like feeling of heaviness. Blood stasis, severe pain. So I mean, C is the best answer. Right? So on the exam, they don't ask the way that you see on the textbook. So they kind of twist it a little bit. So probably that is makes you a little bit more confused of this non-English speaking students. So you have to practice with those questions. A lot of times you use the simple, basic, fundamental knowledge, not really very complicated the, the questions. So use your foundation, because if you don't know, think about the basic foundation and answers there. Anything else? So just this announcement that if you are ready, I mean, if you're ready to graduate, like I told Melissa, thing, if you're ready for the exam, the NCC, when like license exam, yeah, you can try. Yeah, come to the school. You can talk to me, or you can talk to Dr. Phillips that you want to try this the mock test. So you just pick, I mean, make sure that you are all right, because usually I'll give you the feedback that which areas you are not really ready, so you can just last minute fix. Okay. Yeah, but again, foundation 100% pass. Okay. Yeah, mostly on the average 80% pass. So yeah, okay, don't worry. Just study, prepare and go, and you'll be fine. I'm not worried about that. But again, this foundation is basis for other like acupuncture and formula too. So all four modules. So the best time is like probably like a week or 2 weeks before the exam. Make sure that everything is ready. Not like a month or 2 months before. So yeah, be confident. Like yeah, you're good. If your score is no good, then yeah, you have to study, of course. But yeah, as long as you study, and yeah, get many students, like a graduate student or like current student, have the previous exam, those things, right? So yeah, this is a good reference that you can. And after you finish the most of the stuff, then yeah, read those questions. If you don't know, you're not sure, that you can always contact me, and then yeah, you'll be fine. Yeah. Okay. Any other questions? Again, yeah, exam is a lot of times technique. How you attack the exam. How what this person, for the person who make this question, what is he thinking? It's not what you're thinking. What you think is not important. What this person who make this question is thinking. Why he's asking this. So always think in the perspective of the exam provider, or not you. And don't make mistake. How about time? Like, is it you have enough time? You good? Time wise? Because I added 10 more minutes. Usually you're gonna have 2.5 hours. So probably you're gonna have like another 50 minutes, 40 more minutes. So time wise, you okay? Or too short? Hmm. Yeah, yeah, I think you're okay, but the others. Right. Yeah. Okay. Any other questions? Then we're gonna go on to the break and see you in September. Yeah. Don't get crazy during the summer. Mm, right. Really? Thank you, Melissa. Because based on my wife's comment, doesn't look like it, but I believe you. Yeah, I miss you too, Melissa. I mean, anytime you need any help, I need like the information, you just contact me. Right. bye. So what I understand is I just got a email from Joanna a couple of days ago regarding this LEP. What I understand is that international student cannot take online class, only I think one unit, 3 unit online class, and all the others should be in person. So Dr. Zheng is online and he may not available to come to the campus. That's why they create this new online class for international students only. So yeah, and I think Harry and Melissa and Ivy is on the list. Let me check. Oh yeah, Harry and Ivy. Yeah, there's two. Yeah, two is in the list. So no, not Melissa. Sorry. Yeah, the Harry and Ivy. Oh. Yeah, you can ask Joanna because I'm not sure. But I just like informed that they had a class on Wednesday morning. But that's just what I understand. Yeah, so because I have no idea regarding the class who's coming to the class. I just have like they said, yeah, they add me that this Wednesday class. So talk to Joanna. Yeah. Mm. I don't know. Yeah, because I said yeah, I thought everything is set, but suddenly they add this class. So yeah. Hmm? Yeah, because yeah, that I don't know, Harry, because you have to talk to the school. It's not what I decide. I have no nothing to do with that. So you talk to Joanna or Justin, Dr. Chai. Okay. Mm. No, because this is not online. Because this class is in person. Because if you are an international student, you cannot take the online classes. That's why they add this in-person class. That's what I think. Mm. So it's online is fine. Of course, online is fine, but probably you should come to the school, not online. But yeah, again, yeah, because don't rely on my information. Talk to school. Yeah, because don't ask me, because that's what I understand. So if you're in overseas, that I don't know. Mm. Yeah, you're in US. Yeah, that's true. Mm. Harry, yeah, get the clear answer from the school, not from me. Yeah, I, that's yeah, because I have no idea. I just got an email from the school that Wednesday class is added. and I checked the organ. Then I checked the who's in the class, and Melissa. I know the what is it? Was three before, now it's two. But yeah, probably that's what I know. Okay. Mm. Yeah. So talk to school. Yeah, probably they'll. Yeah, today Joanna is not gonna be at the school today. Yeah, Sunday, right? You call tomorrow, and let me know if anything changed. Then yeah, let me know. Okay. All right. Anything else? So you're going to Taiwan, Eric? Oh, Taiwan, Hong Kong. Oh, I see. How long? Oh, okay. So you're not you. Oh, wait for the working days. Yeah, anyway, yeah, talk to the school that. Oh, so you're not okay. So you're not coming to the clinic, and you're not coming to the like in-person class, right? So probably and that time you should be okay with online. Yeah, I see. That's okay. Yeah, but once you come back, then yeah, you should take in-person. All right. Okay. All right. Then anything else? You're welcome. Okay. So have a nice trip to Hong Kong and Taiwan. And anyone else leaving? Yeah, please. Yeah, thank you. Yeah, that helps. Okay, sure. All right. Oh, you too. Yeah. Probably Taiwan is better than here, right? Hopefully no typhoon. Oh, Melissa is not going? Mm, mm. I thought you always move together. Oh, you have to work. Okay, right. Yeah. Okay, so have a wonderful break. And yeah, for Melissa. Yeah, money. Yeah, don't spend too much money, Melissa. Save some. That's why I have no money. Right? Yeah, I think so. Just stop online shopping, okay? Mhm. You better meet then fight, because instead of talking, you just fight. I recommend that. Oh, hold it. Oh, okay, then I'll open this link for a while. So you chat, but I'm leaving. So see you, Esther.